the reason why I'm putting this video together is that a lot of concerned friends have contacted me in the last few weeks, right? Ever since I started talking about me being in Cambodia, the snooZze clinic in Cambodia, and after speaking to a lot of my friends, I realized that there is some misconception about what Cambodia is like. Okay, so there are two specific concerns which were brought up. Okay, so the first thing is that, why are you going to Cambodia? What if you get kidnapped? Then I was like, why get kidnapped? Say no, like a lot of kidnapping cases, there are a lot of scammers and whatever. But to be very honest, Singapore has a lot of scammers also, what? And yes, I did hear that, like kidnapping cases or whatever. But I think, okay, I better not speak too soon, but I think as long as I don't put myself in the position where I'm at risk, like going to secluded areas, deserted areas, following strangers to their houses, whatever, I think I should be fine, yeah? So don't worry about that part. And as I always jokingly tell all of you, right? Like, I don't think kidnappers want to kidnap me because I eat so much. I eat more than what I'm worth. Yeah, and if they call my friends and family, I mean, seriously, ask yourself which of you will actually pay ransom, yeah, to redeem me. I think most of you will tell the kidnappers, I think, can you keep her away from us? Yeah, you can take her, you can keep her forever. Yeah, so okay, don't worry, I won't get kidnapped. I've grown so fat, I think it's very hard to kidnap, yeah. So the other concern that was brought up is that, but what if you fall sick? Like, they've got no medical facilities there, right? I mean, do they have clean water? Do they? Yes, they do have clean water. Yeah, I mean, I'm sorry, but where on earth did y'all get this impression that, like, I don't know, like, you guys seem to think that Cambodia is like, the whole country's like kampongs, like a whole village, fishing village or whatever, farming village. Yes, I mean, they do have farms and they do have the rural areas as well, but generally they're quite advanced. So later I'm going to show you this video that I took when I went on my little tour to RK Premier Hospital, which is a private hospital. Yeah. And you'll be surprised, like, they have got medical devices, medical equipment, which is similar to what they have in the Singapore company-owned hospitals as well. So in fact, RK Premier Hospital, they took over from Prestige, if I'm not wrong, yeah. And I think Prestige is owned by a Singapore company, yeah, something like that. Okay, they were telling me, they did mention it to me, but I forgot because that was 1 month ago. Yeah, so and RK Hospital is a multidisciplinary hospital, yeah. So far, okay, from what I remember, they have everything or almost everything, right? So peds definitely, and very much, I think they're very much an onco hospital, so the patients there are usually pretty long stay. They've definitely got gastro, they've got GS, they've got the nephrologist, I think, they've got infectious disease, they've got, who else? Oral maxillo, they've got, yeah, and I think the oral maxillo person's also the plastic person. What else I see? Okay, I can't remember offhand, but oh yeah, neuro, ortho. So they have, yeah, all that you need lah. Yeah, endocrinologist also, I think, if I'm not wrong. Yeah. So I think when it comes to getting help, right, medical assistance, I don't think it's an issue. And just in case you didn't know, there are like 3 or 4 hospitals, like Singapore hospitals over there. So And if I'm not wrong, I think some of our local specialists do actually fly in there, yeah, fly there to see their patients and all that as well, if I'm not wrong, yeah. So don't worry, I'm safe, yeah. You all tend to think like I'll be like left dying on the road or something. No. And the people there are generally very warm and nice. So as I mentioned in my Facebook post, yeah, it can be the tuk-tuk drivers, it can be the hotel staff, and of course the hospital staff, or the hospital chair lady, CEO, the head nurse. They've all treated me really nicely, yeah. And yeah, and okay, one thing that I like when I visited them was that they actually have quality time to spend with the patients. I mean, of course, they don't like sit in the patient's room and chat the patient all day long, but um they seem to know the patients quite well, yeah. And it's not like very superficial. It's not like, oh, okay, I know my patient, her name is da 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 da, this is her diagnosis, this is the prognosis. I don't think that is called knowing your patient, you know. But over there they seem to know everybody quite personally, which is good lah, you know. It's not the production line nursing where it's like, okay, is it time to change the diapers? Okay, change everybody's diapers. Oh, is it time to feed medicine? Okay, feed every medicine. Yeah, they actually, when I was there, I was actually quite surprised that the chair lady, CEO, the head nurse, they seem to know like everyone. So like as you walk past the rooms, they'll be actually greeting them, and not like a hello, how are you, good afternoon, you know, and walk off kind of thing. But they seem to really know the patient and the family as well. The other thing I was quite impressed, which you will see in the video later, is that in the ward, in the room, I think it's a single room, right? They actually have quite a huge bed for the caregiver, and they've got like two long sofas or something. I remember you can probably sit like, I don't know, 15-20 people, yeah. So I was asking Debbie, I was like are we really expecting like that many people in the ward? And Debbie said, yeah, she said that because, which is true, the Cambodians are very warm people, and they're very close knit. So if something happens to a family member, normally like the rest of the family will be there, yeah. So and I've seen one room where there was like, I don't know, like 10 people there, and yeah, and it's not like, you know, oh, there's a limit, like, okay, only 2 people are allowed, no, yeah, or only 4 people are allowed at each time. No, so family members basically just visit the one who's ill, have their meals together, yeah, as a family in the room, yeah. Yeah, which I thought is actually quite nice, yeah. Okay, so you can watch the video and you can assess for yourself, yeah. And yeah, and get rid of those misconceptions that you have about Cambodia, yeah. It's actually like anywhere else, I feel, yeah. Okay, see ya. Okay, here we are. Oh, there's Debbie. Debbie is the chief of nurses. Okay. Hi, Debbie. Thank you. Can you show us around?
Sure. So
Okay.
this is our receiving area.
Okay.
So we have our consultation room.
Okay.
We're in the OPD department. So I'll
Okay.
show you one of the consultation room. It looks this. So our patient and doctors
Okay.
consultation here.
Okay.
Yes. We also have for examination. Then we have our another ultrasound machine over here.
Right. So is this where the patients go if they come in like in the like after hours, like after 7 o'clock? Right?
Yes,
where
after
you see the
7.
patients.
No. This is actually from 7. This is all outpatient.
Okay.
So from 7 a.m. to 7 p.m.
You
open.
also okay.
And yes, and then if we have emergency, we use our emergency room at the back.
Okay.
Or we can just like a simple emergency. We can
Okay.
in here. then we have a doctor.
Okay.
So we
Nice.
have this is our challenge area.
Okay.
where we take our vital signs
Okay.
and also blood extraction.
Okay.
Yes.
All right.
So this is our
The wonderful
these are
star.
yes, our nurses, our PR.
Hello.
Yes.
Okay, and got awards, right? What award is this? Oh, okay.
Okay. Those awards. Yes. So we have our partner also insurance partners.
Okay.
Yes.
And you got a
So-
pharmacy, a big
And this
pharmacy.
is our pharmacy, and we have a small cafeteria over here.
Okay, let's take a peek.
Yes. For our patients who had finished or had fasting
Oh.
in the morning, so after we extract the blood, then we can have a breakfast over there.
Right.
So yeah, so this is our diagnostic imaging.
Okay.
So, so this is our ultrasound, general ultrasound room.
Okay.
So we have a Philips
Mm.
machine. So
Okay.
we do general abdominal ultrasound
Mhm.
and other ultrasound for the thyroid,
Right.
breast.
Okay.
Hi, doctor. Good morning. We have our guest.
Hey, morning.
Singapore. Yes.
Just doing a little video to show like the whole place because I was very impressed with the size.
So this is our X-ray room.
Okay.
Yeah. So our machine is also Philips.
Okay. Nice.
So this is our control room.
Okay.
Hello. Good morning.
Hello, morning.
I'm sorry, there too. So this is our CT scan room.
Okay.
Yes. How many slides? Also Philips. We can also do a heart CT scan over here.
Oh, okay.
And we have also our mammogram machine.
Okay. Nice.
So this is science, and this is our mobile chair X-ray.
Okay. For the inpatients.
That's for our inpatients.
Okay.
Thank you.
Thank you.
So the rest are just our doctors, the dressing room for the patient, and then the doctors where they do the report. Thank you so much.
Thank you.
Okay. Oops. There you go. So this is our operating room theater. It
Okay.
is actually a major operating room. I just give you a quick, just this
Okay.
because it's very. So this part
Mhm.
is the recovery room, and that on the left side facing the front is the major operating room. And we
Okay.
have the CSSD also.
Okay.
So major surgeries are done here.
All right. Okay.
And we also have one more minor operating room, but it's at the back. But because of the building, the construction going on, so we didn't use that part. And so
Okay.
here is the emergency one.
Okay.
Sorry.
Oh, okay.
So we have our
Defibrillator.
defibrillators, yes, our e-card, our ECG machine.
Okay.
Yes. But we have actually a larger emergency room at the back.
Okay.
I'll show you.
Okay.
But because of the construction,
Ah.
it's not yet used. So here is the endoscopy unit.
Oh, okay.
Okay. So this is our machine for lupus. Yeah. So we have the scopes for colonoscope, and this one here is the endoscopy. Scopes.
Okay.
Yeah. So we often have outpatient or inpatient also.
Okay.
So after the procedure, our patient will bring patient to our recovery room. in this
Okay.
area for the how do you call this outpatient? Okay.
Okay.
actually here.
Ah, okay.
This is where we do the observation for at least 2 to 3 hours until the patient is fully awake.
Ah,
So
okay.
the patient can go home after.
Mm.
Or if the patient prefer to be admitted, then we bring them to the IPD.
Ah, okay.
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 So this one here, we also have another, we made it just a minor operating room. Actually, it's an endoscopy, but we change it to a minor operating room. Yes, so we do small surgeries here.
Ah, okay.
Okay.
Okay. I'll get lost in this place if I come alone.
I'll show you one more. This is actually the extension of the hospital, but it's not yet finished
Okay.
because of the construction. We don't use this part yet.
Ah, alright.
Yes.
Okay.
We have another minor operating room here.
Ah, okay.
Yes. Yeah, this is emergency. Our big emergency room.
Ah, okay.
Because the plan is that building will be the OPD later on.
Okay.
Okay, outpatient department or specialist consultation department.
Okay.
And it could be our ambulance can just stay there.
Ah,
And
okay.
patient can come here.
Come straight here. So this is like the recess,
Yeah.
is it?
Like it will be the front area later on.
Okay.
So here. So we don't use it yet because of the construction.
Ah, okay,
So
okay.
it's already set up.
Right, okay.
Alright. Here is another minor operating room.
Hey.
Yes. Here.
Okay.
We also have our anesthesia machine. But like what I said, it's not yet functional.
Okay.
We used it before, but because of the construction,
It's just on hold?
I hope because I don't want the patient to be disturbed in
Ah.
the smell.
Okay, okay.
And then we have also an elevator here, a lift going up to first floor and second floor.
Ah, okay. I need to get used to the floors because you know, like even in the hotel, I thought first floor was the ground floor, but I realized like over here ground floor is G, right? It's not 1.
We're the same.
Oh, okay.
I said before, okay, first floor, ground floor.
In the
In my country too, the first is the level 1.
yeah. So
Same in Singapore.
yeah, in the hotel, I was like, I looked like I was playing with the lift buttons because I was like pressing 1 M G.
So this is our way to our laboratory.
Ah, okay.
This is our pharmacy, but again, this because of the construction.
Ah.
This is the CEO office before,
Ah, okay.
but because of the construction going on, so she still moved there.
Ah, okay,
Yeah. So this
okay,
is our laboratory.
okay.
Hello. Hi, Bong. Hello. Oh, I think the stuff went up.
Ah, okay.
So most of the equipment also are Siemens.
Ah, okay.
You can come over.
Oh, okay.
You can come over with me. Yes.
I see. Okay.
Okay. Alright. So this way is a warehouse. So this way is our specialist consultation rooms are over here. And we also have for pregnant women, we also have this room, we call it the CPG room.
Ah,
Yes, where we monitor the mothers, the pregnant moms,
ah,
and
okay.
the fetal heartbeats.
Ah, okay.
Yeah, during labor.
Ah,
Then when the mother is fully dilated, then we bring to the delivery room.
ah, okay, okay.
Yes. So this is our specialist consultation room. But now those three rooms are actually the office first of the CEO, our chair lady, and the assistant. But this one is one of the specialist consultation room.
Okay.
Okay. This one is for OB-GYN.
Okay.
We have our colposcopy machine.
Okay.
Yes. For more investigations. And this area. Yeah. For more examination.
Okay.
Yes. Okay. Then that's the office of the CEO.
Oh, okay.
Before it's also our doctor's office for cardiology, but then
Temporarily?
temporarily because of the construction.
Right. Okay.
All right.
Okay.
So this is our receiving area. So we have one here. I'm not sure. This one is our.
Oh.
I will open the light
Okay.
inside
All right.
so you can see.
Okay.
Hold on, let me check this. Okay. Some of the equipments here. Actually, this one could also be one office.
Okay. Okay.
But for now, I put
Storage.
yeah, I put some of the equipment.
Okay.
More equipment. But that one could also be so this is our nursery ward where we grant our babies. Yes.
Okay.
So we have our phototherapy machines, our baby warmer. Yeah. And this for we back the baby.
Okay.
Okay. Our pediatric ward. This is only an observation, like an observation room for
Okay.
yeah, because you know most of the patients they prefer to have a private room.
Okay.
Yeah.
Okay.
Over here, we have we also have our visual therapy room.
Oh, okay.
Yes. For our clients. Usually they come here around after lunch.
Okay.
Actually, we have two different physiotherapy.
Okay.
We have the Taiwanese and also one Filipino. But this one, the Taiwanese, Cambodian, they have this physical therapy incorporation with hydrotherapy.
Oh, okay.
Yeah. And they use some oils.
I see.
And but for the Filipino physiotherapy, she's also an occupational therapist. Yeah.
Okay.
Yeah. So we have also most of the time in the afternoon they come here.
Okay.
Yeah.
Okay.
Okay, Michelle, this one is for ICU.
Okay.
ICU, there is a general ICU. Yes. So we are fully equipped with ventilators. Also from Philips.
Okay.
Then, yeah, from Mindray.
Okay.
Yeah, from Mindray. Yeah. So at least we have 6 beds here.
Okay.
And they also have one room for an ICU that is for isolation.
Okay.
It's a private room.
Okay.
So this isolation unit.
Ah, okay.
And it's a negative pressure room.
Okay.
Yes. So for patients who have communicable disease, then we put them here. Yeah.
Okay.
Not COVID yet. How's COVID in Singapore? It's gone, right?
Gone, but coming back. I think now there's another wave, from what I understand.
Oh.
Yeah.
And of course our delivery.
Oh, okay.
Yes.
So this is the delivery room.
But downstairs in our operating room, we have a double setup for it could be also a delivery room at the same time for C-section.
Okay. Understood. Wow, this place is like a maze.
Yeah. we have a, how do you call this way and that way.
Okay.
Okay, so I will bring you to the inpatient department.
Okay, that one I will I won't video once we get up there. Yeah.
It's okay, you can video rooms.
Okay.
Just the one with the outpatient.
Okay.
Because at the moment I have patients.
Yeah. So like currently the ICUs and all that are not used because you haven't officially started, or?
No, actually we used them already.
Just that fortunately there isn't any ICU patients now.
They already discharged. And when they are already okay, we move them up.
To the general.
General.
Okay.
Because the patient family request. If the patient is better, then we bring them up already.
Right. Okay.
But not like other ICUs that it's really departmentalized. This one is a general ICU. Yeah.
Right.
Okay, so this is our ITU department. So we have two rooms. We have this on the right and on the left side. So here on this side are wider rooms.
Okay.
VIP rooms.
Okay.
And this one are our regular rooms.
Okay. Okay.
Because I have only last night.
Okay.
So he discharged already.
Okay.
Yes.
So this is
This
actually.
one of our VIP rooms.
Okay. Oh, so that is for the family member or the help, caregiver?
Because our Cambodian families are very close to each other.
Yes.
They prefer to be taken care of with their family member or relative.
Yes.
One or two, something like that.
Yeah, so I noticed, I mean, one of the rooms had a lot of people, right? The whole family.
Yes. I was like, oh, the first time, because we live in, right? But here in Cambodia is a part of their culture.
Oh, yes.
But they also follow if we set them some policies like restrictions.
Yes.
It depends on the situation.
Yeah, so that's why there's so many chairs. It's the first time I'm seeing like so many chairs for visitors, and
In one room.
Yeah, correct.
That's why, thanks God, there's no more COVID.
Yes.
Because before I only allow one.
Oh yeah,
I
correct.
only allow one relative or.
Yeah, so this is the room I was talking about. Okay, maybe I'm very snorkel, but I've never seen a hospital room that can accommodate that many visitors. Yeah. Good, right?
So these are also other rooms I'll show you.
Okay.
Wider rooms. Most patients that comes here are the middle class.
Okay. Middle to upper.
They want private. So here just the same.
Because I did some reading, this hospital is one of the top local private hospitals, right?
Yeah, recently we just received an award again because customer service, basic from the survey from other hospitals in Cambodia. So this is our inpatient department.
So this is where I did the sleep study, right? Last night?
Yes.
Okay.
Yeah, so we have patient there. Hi, good morning.
Morning. Just doing a little video. Hello.
Oh, sorry. Still have good morning. I'll come back later. Sorry, I have a patient.
Yeah.
A patient.
Okay.
Is this empty?
Yes. Okay. So this is the regular rooms.
These are the regular rooms.
Okay.
So each rooms have already patient monitor, IV infusion pumps.
Okay.
Yes. So we use them for each patient.
So which means it's already in the room. You don't need to like go to the store and bring out
Yeah.
like for
We try to put one each.
Right.
TV for the patient.
And this is the wardrobe for the patient.
Yes.
Okay.
For the cabinet for the patient.
So do they stay that long?
Most of the patients stays here. Like because we are cancer hospital, I have long terms.
I see. Okay.
Yes,
Okay.
extended care
Right.
sometimes.
Right.
Yeah, so our patient stays here like 20 days.
Okay.
So 1 day to 20 days, to
Right.
3, 7.
Okay.
Yeah,
But not like palliative. I mean, like let's say palliative care until they pass. You don't take those patients, right?
They
Yeah.
all usually they want to
Go home.
go home.
Okay.
That's for the local culture.
Yeah. Okay.
Yeah, but for expats,
Okay.
sometimes they go to their country already. So
Oh.
we try to
Okay.
have them arrange. We arrange for the repatriation.
Mm,
Yeah,
okay.
together with their specific embassy.
Right.
Yeah.
Okay.
Mm.
So usually like around how long before they are expected to pass on do they actually go back to their country?
Usually at the early stage, we explain already. Yeah,
If the
when
prognosis is
they're
not
still
good.
able. We also have partner hospitals in Malaysia.
Okay.
Yeah, like what I mentioned. Sometimes if we do not have the service here, like example, a specific chemotherapy or the technique, like
Right.
the TACE,
Okay.
like for liver cancer,
Okay.
like only the part is being treated with chemotherapy.
Okay. Okay.
Because Cambodia don't have it yet.
Right. Right.
So we refer them there.
Okay. I see.
We try our best to give them hope.
Gee, that's quite important, right?
To give them hope, but it depends on the patient's family.
Yeah.
But so far, we were able to manage all our patients very well.
Okay. Yeah. Because some families will choose not to have any aggressive treatment, right? And to just let the patient.
They bring home some, but some patients, yeah, they want to try because of the cost sometimes. If they have insurance, usually they still try.
Right.
But some they just want to stay home with the family.
Right.
Yeah, stay with the family. So we give them some psychological, counseling, both patient and also the
Caregivers.
Yeah, and the family as
Right.
well.
Okay.
So they will, as long as we breathe, there's always hope.
Yes.
Yeah,
Yes.
miracles happen every day.
Yep. Yep.
Yeah.
Correct. Yeah.
That's true. I have patients who are already experiencing miracles.
Oh.
Yes,
Awesome.
we can never say.
Yeah. Correct. Correct.
We all die, but we don't know when.
That's true. That's true. Okay.
Yeah, so these are our rooms here. So we have patients over there.
Yeah. So don't worry. I face the camera downwards.
So that next area also is our meeting room. This one.
Or like a staff meeting room, or for patient's family.
It could be patient family or staff.
Okay.
And this one is for our doctors' room.
Okay.
Staff doctors.
Oh, like an on-call room.
Yes.
Okay.
So this is our meeting room for our staff.
Okay.
Yeah.
And for family conferences as well, I suppose, if you need to speak to family.
And in this area, this is our brighter.
Usually, like for family conferences, like do you all have a limited number of people to attend the conference?
Only the specific or
The spokesperson.
yeah, or the representative from the family.
Okay.
Because sometimes they don't want also they want confidentiality. So I always ask the patient who he or she authorized us to speak with. Yeah.
And because I
Or
thought
to
like
disclose
it gets messy.
about- yeah.
It gets messy. Yeah.
Sorry for this consortium. So this our nurses room.
Okay.
Actually, here is my office, but it's also
Okay.
that area is my office. But we had make it first.
Okay.
Do some conferences here. Changing room for nurses.
Okay.
Our HR and finance department. And at the top also is our offices for our admin.
Okay.
You see that this part is already construction.
Okay.
Because it's a plan. I'll show you a little bit.
Okay.
There.
Okay.
It's an extension. They plan to have more
Okay.
IPD patients.
So there's
IPD
another
room.
wing actually, is it?
Yes.
Okay.
The one they showed you.
Because I
downstairs.
thought it was just the driveway, that's it, but actually there's a building. Okay. And I thought this place was big enough.
That was their plan.
It's never big enough, is it? So the patients that you have over here, they are locals and expats as well?
Basing from my monthly census, almost half are expats.
Oh,
And
okay.
Yes, almost half are expats and half are locals.
But if they're expats, is there any like communication, like difficulties in communication?
That I tried to train the nurses. Most of the nurses that I hired can speak the language, both English and also Cambodian. But for me as a foreigner, I try also the local.
To speak Cambodian, yeah. I was trying to use Google Translate yesterday and to try to learn a few words, but after I turn it off, I will forget.
Before, I have also some local staff who could speak Chinese. Yeah, so that's good also. And doctors who could speak also Chinese. Yes.
I'm always very impressed like with the doctors, like your Korean doctor and all that. Like how do they communicate with people?
So if the patient is a local, so they were able to communicate, translate with our local doctor or with our nurse.
Okay.
But sometimes if really like a medical term, because it's a little bit, they said different, when you translate it in their local language. So I asked our local doctor, it would be better doctor to doctor
Yes.
to translate.
Correct.
Because I'm afraid it might not be the same as
It might
the
be
translation.
yes, it might get lost in translation.
Yeah, so even with our consultation, like free medical consultations,
Right.
yeah, we
Okay.
do.
Oh, you do free okay.
Yes, like last month we have a free heart check with our partner hospital.
Right.
And then this month we will next month we will have one again
Okay.
about breast cancer.
Okay,
So free
okay.
breast health checkup. Yeah, so mostly monthly we have one.
Right.
Yes.
Is there any way we can take a peek at the major OT?
Oh sure. I will bring you. Let's check.
Yes. Because,
Let's bring this entrance.
Okay. And then change the shoes, is it?
Yeah, if you want.
The
to
shoe cover?
wear- Yeah, we have the shoe cover. It's for been teaching nursing. I'm a nurse professor back in the Philippines. Before I came here in Cambodia, like almost 15 years.
Wow.
And then
And your family is here as well, right?
only my son.
Ah, and he's coping okay.
Oh yeah, because he's studying aviation. Yeah, so I let him stay with me for a while.
Oh,
For
okay.
2 more years.
Oh, okay, okay.
Okay, I'll show you. This is first of our CSSD.
Ah, okay. Ah, yeah.
We'll do the
Dr.
sterilization.
Kun showed me briefly that day, and I thought it was, yeah. Ah, okay.
So here we receive the used instruments.
Ah, so this is
and
the
then
dirty
process
area.
the dirty area. Okay. Trying.
Okay. Yeah, because I think like usually it's a main concern, right, for like patients, potential patients, as to whether you have proper processes for cleaning and yeah.
And then this one is when we receive the newly packed.
Ah,
It's
okay.
sterile already.
Okay.
So we just open it up here.
Oops.
Alright. Sorry.
No worries, no worries. Okay, so this is where you actually pass it over to the.
Pass it to the operating room.
Ah, okay, okay.
Okay. So for sterilization.
Okay, so at least everyone can put their minds at ease.
Yes.
And this is where the packing is, right? Before autoclave.
And that is a plastic. The other one is a plastic sterilization.
Okay. Oh yeah, I realized that the doors don't open even if you are like blocking it, right?
Our dressing rooms.
Ah. Ah, okay. Oops, sorry, my shoe cover came up. Hang on.
I love surgery.
Really?
Yes. I love surgery.
Okay, so.
So these are our this is our anesthesia machine.
Mm-hmm,
So
mm-hmm.
we have our here. This one
So
is
like throughout your life, besides teaching or lecturing, you were OT.
Yeah, because in the Philippines, usually, if you are a clinical or a instructor,
Mhm.
you teach in the university 3 days, and then clinically 3 days too.
Ah,
So both.
I see, I see. So OT is your passion.
OT, they always put me in OT, the delivery room, emergency room.
Okay, that's very much
Just
everything,
three.
right? Okay.
Yes.
So
But
this.
now I sometimes assist still.
Okay.
But most of the time I do just the management
Ah,
and the nursing.
okay. All right. Okay. Oops, okay.
So after we do this is our recovery room.
The what room, sorry?
Recovery.
Ah, okay.
So post surgery,
Ah,
we're going to bring the patient here to observe for 2 to 3 hours.
right.
If it is needed, then we bring to ICU,
Okay.
or after we bring them to the room.
Right. So it's not definite that they go straight to ICU or high dependency.
No.
If they're okay, they go to the general
Yes.
ward. Ah,
But it depends on the anesthesiologist.
right.
I say, but they have to stay here at least
Okay.
3 hours.
So it's like even for the babies as well?
For the babies, it has to be room in usually with the mother. For cesarean section,
Ah, okay.
we bring first to the nursery
Ah,
until
okay.
the mother is better,
Okay.
and then because it's their culture, so to room in together.
Ah, okay, okay. So it's so the best nets and all that, the baby cuts are basically for the ONG patients then.
Yes.
Ah, okay.
But for normal deliveries, we room directly to the mom.
Ah.
We do latching.
Ah, okay, okay.
We still encourage the World Health Organization first embrace.
Ah, okay.
So that is those are our dressing rooms.
So this is the corridor that we came in just now, is it?
So where we receive our patient here.
Ah, okay.
Here, and this is our main entrance.
Okay, where we came from. And this is finally the end of the huge building. It looks very small from the front, right? So
Yes.
like from the front, I'm like, oh okay, what a nice cozy medical center. And then when Dr. Kun actually showed me around, I'm like, because she was telling me that, oh, it goes very deep all the way behind, and I'm like, really? Now I believe her.
Yeah, the first time too, I said,
Okay, so now after watching the video, what do you think? Like, yeah, it looks like a regular private hospital, right? Yes? No? No, I thought it's fine. Yeah.